Hello again, everyone, and welcome to the program. And thank you for joining us for Trent Talks and this week's episode, Punishment in the Pandemic. I'm Stephen Stone, Trent University Chancellor and proud alumnus. Today, discussing the impact of the pandemic on Canada's criminal justice system and prison populations, we're joined by Dr. Marie Knudsen, Assistant Professor in the Department of Social Work, and Assistant Professor Dr. Amy Spendik from the Policing and Community Wellbeing Program at Trent's Durham campus. Professor Knudsen's research focuses mainly on the criminal justice system. Her teaching interests include critical and structural social work, reflexivity, along with some of you maybe will be learning what reflexivity means, and politicizing social policy decisions and processes. She was a social worker in Toronto for several years, first as a child welfare worker, and then as a policy analyst at a criminal justice policy organization. Professor Spendik's research focuses on the role that the use of force plays in how correctional officers are trained and how they manage incarcerated populations. She also looks at how training influences how corrections officers understand prisoner behavior. She just recently joined Trent University Durham as the Policing and Community Wellbeing Program Coordinator. So welcome to Trent.
Thank you.
Before we begin our discussion today, we would like to first respectfully acknowledge that Trent University is located on the treaty and traditional territory of the Mississauga Anishinaabe. We offer our gratitude to the First Peoples for their care for and teachings about our earth and our relations. May we honor those teachings. Elsa Marie and Amy, welcome.
Thank you.
And thank you for joining us today for this fascinating topic, albeit one that perhaps doesn't always get mainstream attention. So with that, let's just jump right into some questions from our audience for you both. And maybe Amy, looking to you first. As a background for the rest of today's conversation, could you maybe give an overview of corrections in Canada, but specifically here in Ontario, where we are?
Well, certainly. So Canada has two main primary incarceration systems, one at the federal level and then one in the provincial level. Now, each province and territory has their own correctional institutions, and they typically house people who are on sentences of 2 years less a day, so it can be up to that point. Anyone who has a sentence that's more than 2 years is going to be housed in the federal system. Now, in most cases, most of our prison population in Canada are housed in provincial institutions, and in Ontario in particular, that is primarily people on remand. Now, the remand population are individuals who are in custody prior to when their trial comes to court. And so they're remanded either because the charge that they're on deems them a public safety risk, so they shouldn't be out in the public, or they are perceived to be a potential public safety flight risk, so that means that they probably won't show up to court, maybe they have a history of that. Or these are individuals who cannot afford the bail that's been set and they cannot find someone who is able to post bond for them. So most of the people who are incarcerated in Ontario in particular, and on the other provinces for sure, are people who are technically and legally innocent of the crimes that they have been charged with. They haven't been convicted of such yet, and yet they are incarcerated until their time. So with that being said, we also have to recognize that both the prison populations at the federal and the provincial level are very overrepresented by our Indigenous peoples and Black Canadians. And so understanding that the system in and of itself is racially disadvantaging is important to consider. And then when we couple those characteristics with the fact that we now have COVID-19 in our institutions, that makes it much more difficult, right? So this is it's difficult for prisoners, but it's also difficult for correctional officers. And part of that comes from the fact that our institutions don't have very good healthcare or proper healthcare to manage COVID-19. So when we have a whole bunch of people that are confined in a space and they don't have access to their families and they don't have access to resources, that makes this an even more difficult space to be.
Well, and Elsa Marie, just picking up on that, And talking specifically about the pandemic, I guess two questions in one. In what way has COVID-19 affected our corrections facilities? And Amy started the conversation, but also how has the pandemic affected the families of incarcerated individuals? I guess in terms of visitations, communications, or maybe in other ways.
Absolutely. And as Amy said, before the effects of the pandemic ever hit, we expected there to be a big impact because of what we know about our institutions. So for a few different reasons, prisoners are much more susceptible to contracting COVID-19 and also to experiencing serious effects of it. So number one is that it's almost impossible to physically distance inside an institution. So people are living in very, very close quarters. There's a lot of overcrowding in prisons across the country. These institutions are not particularly hygienic at the best of times, and this is the worst of times. So in a normal time, prisoners have difficulty accessing basic hygiene supplies like soap and sanitizer, which are now even more essential. I'm reminded here that a recent Ontario court decision has described our newest institution in Ontario, the Toronto South Detention Centre, as being inhumane and inconsistent with basic human decency. So that's the condition coming into the pandemic. And the other thing that makes people more susceptible is that the people who go into prisons are already experiencing poorer health than the general population, and they're more susceptible to the serious effects of COVID-19 because of their poor health status. So people who go into prison are much more likely to be poor and to have experienced adverse childhood experiences, which in turn make them more susceptible to long-term chronic health diseases like diabetes and tuberculosis, which are also ones that can make COVID-19 more serious. But thirdly, we know that the healthcare provision inside institutions federally and provincially are really poor. They're inconsistent and poor across the country. And so all those things combined to make us really worried about prisoners before the effects of the pandemic ever started. And indeed, we have seen these significant effects. There have been outbreaks in several prisons in BC and Quebec, and here in Ontario in our provincial prisons in Brampton and to some extent in Hamilton. We've seen hundreds and hundreds of prisoners who've been infected, and that's with quite low testing rates compared to the population. We've seen several hundred staff infected. We've seen 3 people died of COVID directly. However, these numbers do seem to be on the decline, so that's wonderful news. We still have concerns, though, about inadequate testing and slow testing. We have prisoners not able to access masks. We have staff who were originally not able to wear masks at their job, and we have concerns that that prisoners can't keep their hands clean. So, but in response to this, of course, a number of policy changes were made that have a huge impact on the daily well-being of prisoners and also their family members. So we had visits all canceled. We had community members, so volunteers coming in to visit or to run programming for prisoners has all been canceled. And prisoners are really facing lockdowns and, for some of them, solitary confinement-like conditions. And so this leads to both concerns for prisoners. We know that solitary confinement, lack of programming, lack of visits is incredibly harmful to prisoners' well-being. But it also has an impact on prisoners' families, which is what I study. Families haven't seen, much less touched their loved one in prison for almost 4 months now. And these are families who already experience a lot of challenges maintaining relationships and keeping contact with their loved one in prison because of things like the distance it takes to travel to a prison to visit, the expensive nature of visits for a variety of reasons. Phone calls are expensive and can be very difficult to access. So there's a lot of desperation, a lot of confusion, loved ones desperately trying to get information on their on what's happening with their loved one inside. I've heard from a colleague at the Canadian Families and Corrections Network that their toll-free line that they operate for families of prisoners has had a massive upswing in calls. And there's very few services in this area. So the few services that do exist, like CFCN and Kids with Incarcerated Parents Canada, or KIP, in the GTA. Those few services have tried to step up, but there's a lot of need that's not being met.
And I'd also like to add, if I may, that the effect of COVID in the institution is not just on the prisoners, right? Correctional officers are working in the same environment, and they are very susceptible to the risk of contracting COVID, and not only for themselves, but then they're coming out to the community and they're worried about it mixing with their families. These are people who don't have the luxury, oftentimes, of being able to isolate away from their families, right? Correctional officers don't make a lot of money, generally. And they also certainly do not have the ability to work at home. So all of the luxuries that maybe we have been complaining about, having to work at home or be away from friends, is very difficult for correctional officers. Coupled on the fact that working in a correctional institution is extremely stressful. It's stressful for the prisoners, and it's really stressful on the staff. So when you add COVID and the fear of a contagion running wild in your institution, the tension that's already there is building. And so correctional officers are concerned about the potential for violence, resistance, partially because PPE is very limited for prisoners, but also for staff. Now, staff do have, or now given, PPE, but they're very limited. And they actually had to lobby the Ford government and beg them for masks and gloves because they were denied it early on. And so correctional officers are in the mix of this. Now, the other problem, of course, is if prisoners get ill and they don't have the facilities, they don't have ventilators or a lot of the other high-tech equipment, then they have to be transferred to the community hospitals. And that puts an even more burden on an already burdened hospital system when you have more people coming in. Of course, then you have to have security with the prisoners because they can't be there alone. And it's a real administrative nightmare to work with people who are ill, but they need the services, right? So the connection between community spread and the corrections becomes even more potent when we have people who are getting ill and they can't be treated within.
Well, and Amy, staying with you for our next question, because earlier you talked about remands. The pandemic closed the courts in Ontario, limiting or slowing access to trial for some anyway. Can you speak from the perspective of individuals awaiting trial? What does this mean? And are there going to be longer term pressures on the system?
Well, certainly when you close down courts or you delay court processing, you have people sitting in remand for longer periods of time. They don't know when their case is going to be heard. They don't know if they're going to get their bail hearing. They don't know if they're going to be allowed to be released, because if there's an outbreak in the institution, they may not get released. And so we already have a court system that's extremely backlogged and taking long periods of time for the cases to go through anyways. So when you close the courts because of health-related issues, which of course we would expect them to do, you are going to have people in remand for longer period of times, and that increases the mental pain of being incarcerated. Remember, like I said earlier, these are people who have not been convicted of the crime that they're charged with. So they are enduring a punishment, if you want to call it, for longer periods of time when maybe they could be out on bail or whatnot. And so, certainly this increases the tension in the institutions. People are concerned, right? You don't want to spend more time incarcerated than you need to. And the backlog of cases is really going to have a net effect that everybody's going to wait. Now, they do get credit for the time that they're in remand, right? So for every day in remand, they get a day credit for their on their sentence. But remand facilities are very difficult places to be. They tend to be high security. Everyone is deemed maximum security in classification for risk. So their lockdowns are common. Restrictions on programming. There is no programming in remand centers. And all of that makes the experience that much more difficult. And then couple it with the probability of you getting sick is challenging for people.
In our next question, Elsa Marie, turning to you, have we seen any reduction in the size of the prison population in response to the pandemic? And as background, we've seen in the US media a lot of publicity about high profile and non-high profile prisoners being released early. So I guess the question is, to what extent is this the case in Canada? And is there, and assuming there is, how should we address the perception of compromised community safety as a result?
That's a great question. And there has been to some extent, but not nearly as much as some of us may have hoped. So at the very start of the pandemic, criminal justice organizations and prisoner rights advocacy groups around the world have been calling for states to massively reduce their rate of incarcerated people and decarcerate in order to prevent outbreaks, so that prisons wouldn't be so overcrowded. There's sort of two approaches that states can take to reduce the impact of the pandemic in prisons. And one is to manage and prevent the disease, which we've spoken about. But the other is to simply have less people in prisons. And so that's been the call by many. And in fact, that's been the call long before COVID hit. And so this can be achieved in a few ways. One is to not have as many people at the front end, so to have people get bail more, so there aren't so many people sitting on remand and endlessly waiting for their trial or sentencing, often on very crimes that we wouldn't consider sort of violent or major. But it can also happen on the other end. So people who are sentenced can be given temporary absences out of the prison. People can be given early releases through a variety of mechanisms, including parole and probation. And so there's been some success with this. In provinces, we've seen some success. So most provinces have seen a significant to modest reduction in their incarceration rates at the provincial level. And this has been achieved really through concerted efforts by criminal justice organizations and advocates and public health officials to advocate for reductions in these numbers. And also the criminal defense bar has been just tireless in working for individual clients, but more broadly advocating for fewer people to be held on remand. There's also been some reasonably decisive and reasonably fast action by provincial governments to limit those numbers. And so we've been really heartened by that. At the federal level, we haven't seen quite as much decline, and that's been very disappointing. So there's only been a small decline, contrary to what our minister is telling us. It's a very small decline in comparison to what would have been the normal decline over this time, because of course, people are entering and leaving the correctional system all the time. So we really haven't seen a meaningful change at the federal level, which is disappointing. But to the next part of your question, which is maybe of more interest to viewers, what happens to these people that are released from prison? Is there going to be chaos because we have prisoners released? And to that, I'd say mainly, be aware that the prison population is not at all like what you might know from crime and law and order shows that you may have watched. So contrary to this sort of hardened criminal who's in for life, that's not at all typical. That's not at all reflective of the average prisoner in Ontario. So the average prison sentence is very short. The majority of prison sentences in Ontario are under a month long, and people are often released on time served. So they've already served essentially their sentence on remand, even though remand is not at all designed to support people on a sentence. The majority of people in our prisons are not the kind of hardened, violent criminals that we see in our cop shows. They're people in for robbery, theft, administrative breaches, and all manner of other nonviolent offenses, and a lot of property offenses. So secondly, I'd remind viewers that most of our prison population is on remand. They haven't been convicted of any crime, and so that hopefully lowers some of our fear. That said, I'd like to really, step back and ask us to be critical about this view of, who's a violent prisoner and who's not a violent prisoner, because we have to take to put our critical thinking cap on, as I always say to my students, and ask the question, how does and who does the classification of who are the people that are a danger to us? We know that not everybody in our prisons is a danger to us walking down the street, and they don't make our communities less safe, which may surprise some of our viewers. But we also know that our criminal justice system disproportionately criminalizes Indigenous and Black people, as Amy mentioned. So it does that through police stops. More likely, Black and Indigenous people are more likely to be stopped by police, to have police use of force, to not get bail, to be sentenced to longer sentences. So categorizing prisoners as being a lower or higher risk to our society, to our community's safety, is also a way that we sort of reproduce this this discriminatory impact of the criminal justice system. And I'd point you to work by Justin Pichet and Robin Maynard and a lot of the folks who are taking critical views of our systems. And then finally, I think it's really incumbent on us to ask, if our concern is keeping our community safe, well, what kind of things keep our community safe? And I can tell you, any criminologist in the world will tell you that keeping someone on a longer sentence is not what keeps our community safe. Mm-hmm. Having been on a longer sentence, it does not predict someone being less likely to offend. The things that make people less likely to offend after they leave prison are housing and getting a job and having relationship with family. And so if what we're concerned about is community safety, those are the kinds of services and supports we should be concerned with increasing and supporting. And it also happens to be a much cheaper kind of service than keeping people in cells.
Well, and also, Marie, this is a follow-up question, and this comes from me, not from the audience. My understanding is that the rate of incarceration in the United States, in other words, the number of prisoners per, let's say, 100,000 population, is much, much higher, maybe like 4 times higher than the rate in Canada. And yet I have the sense that we're a safer community. I mean, maybe that just goes to exactly what you've been talking about. Is that the case that the United States is so much more prison friendly, I guess, or unfriendly than Canada?
That's exactly right. My students are always astounded when I show them the graphs of the incarceration rates around the world. So in the global north, and so we're not including a couple of countries here or there that have massive incarceration rates, but in the global north, the U.S. far and away eclipses any other country by a mile in terms of how many people it incarcerates. We see incarceration levels at a rate of almost 4 times as high as in Canada. In Canada, we incarcerate just over 200 up to sometimes 250 people per 100,000. And in the US, they're up over 700. They are starting to make some changes. And all of this started in the 1970s. In criminology, we talk about this rise of mass incarceration. And we saw a massive use of the incarceration system seemingly to try and solve any and all social ills. And what this resulted in was a massive population of prisoners who, as I've just explained, are no less likely to offend on their way out. And it's an incredibly expensive system. It's an expensive system to run, but it's also expensive for communities. And does it make us safer is the big social policy question. I mean, I teach social policy, and we always need to ask, is the treatment doing what we want it to? Is this intervention doing the thing that we want it to do? And I think a lot of my students and a lot of our viewers today would assume that the purpose of the criminal justice system is primarily to keep us all safe. And the answer to that is a resounding no. The prison system does a very poor job in keeping us safe. And mainly because it doesn't reduce any of the things that make it more likely that people are to offend. In fact, there's really credible research that for some populations, the moment you step into a prison, you're more likely to offend. So, for example, for young people. And so if what we want to do is make our communities safer, prisons are the last thing we should do, and we certainly shouldn't emulate the US on this point. And it's been really heartening to see that prison rates have started to come down in the last decade. We hope that continues.
Well, and this leads to our final audience submitted question, and I think it's follows exactly from what you were saying. We're seeing a lot of criticism of policing and the broader criminal justice system all over North America right now. So is this an opportunity to reform the criminal justice system? And I guess a follow-up question would then be, how? And maybe Amy, I'll ask you first.
Sure. I mean, we're certainly at a really important juncture where we start and we have an opportunity to question, what are we doing here? Basically, that's the ultimate question. And certainly when we look at what's been going on with policing, we have to question about how police are doing their job. And more importantly, how does the justice system in and of itself work, or how is it organized? And we are in a moment where we have an opportunity to see reforms to make it much more conducive and supportive of community need, right? And recognizing, of course, that the concerns over racial discrimination and the connection to criminal justice practices cannot be ignored. It has to be part of the discussion. Now, police certainly play an important role in these justice reforms, and they certainly need better training on how to be more community responsive. But the change also needs help from the community, right? So it's not just the police have to change their ways, clean up their act, and everybody else will be fine. It is a relationship. It is a reciprocal relationship between community and the justice system. Now, fortunately for us, and in fact, Trent is at the forefront of trying to do some good in this department. Certainly, my program, the Policing and Community Wellbeing Program, is structured and designed to help students learn how to identify what social problems are, be able to negotiate and navigate community organizations, to work with community members to find solutions, and to have an open dialogue between people who want to go into policing and other social service related jobs. So students who take our programs are really going to be coming out of their degree programs with a better skill set to be able to do what community policing is supposed to be able to do, which is work one-on-one and hand-in-hand with community members, so that safety isn't just police officers coming in and arresting people. Safety really is about the community working together to find out what is acceptable and what is not, and how we can work together. And our students will have that opportunity. And that's one reason why I'm very excited to be the coordinator of this program, because I think this is a real opportunity for Trent to be at the forefront, but also for our students to have those kind of skills that are going to make them better police officers or better social workers, better mental health workers in the future. And so that's one opportunity I think we have that is unique across Canada.
So that's the last of our audience submitted questions. But I always like to ask, are there any positive takeaways and lessons we can take from the pandemic in relation to the criminal justice system? And maybe Elsa Marie, you first.
Sure, I'd be happy to. You know, this has been a period of so much grief and harm and isolation. And so I'm cautious about sort of pointing to a silver lining, but I really echo Amy's statement that we're at a time of reevaluation, a real opportunity to ask some critical questions about why do we do things the way we do? Because this is a time when our society's inequities become really stark. So this is a pandemic that's really magnified the oppression and inequality and lack of power and privilege in our communities. And so in social policy, times of crisis have historically, times of social change and crisis have historically been times that at some points precipitated or instigated big review and sort of paradigmatic transformation. So I'm thinking after the Second World War, when we had a real transformation in the way we thought about the role of the state and the role of the social welfare system and what was our responsibility to each other. We call it now the golden age of social welfare. And this could, we certainly could instigate this kind of review today. I think naming all the things that we've named today, there's been a lot of concerns about the criminal justice system named. And I hope that what that engenders is a lot of critical thinking about why we organize our criminal justice system the way we do. It's clear that the people who live and work in prisons are more likely to be deeply affected by COVID-19. And so it demands that we ask, why is that? Is that something that we accept? Is that something that's okay? You know, are we okay with the fact that our criminal justice system, our prison system is overcrowded? and doesn't provide great healthcare and disproportionately incarcerates people who are Black and Indigenous. Is that something we are aware of? And if not, we are now. And so what are we going to do about that? Is that something we want to continue with? This is a time of reckoning. Are people in prison disposable and have no value? I hope everybody listening to this would say absolutely not. I know to the families that I have conducted interviews with, they're not disposable. They are people with value. They are parents and children that people in our community love. And so if they are people of value, then how are we valuing them as a society? What do we really want to do with our criminal justice system? What do we seek to have our prison system, this public service that we pay a ton of money for? What do we want of it? And is it doing it? Is it up to the job? If we want our communities to be safer, do we have the right social policy in place? Are we doing the right things in terms of safety? And a lot of criminologists, including two here today, would say there's a lot of work to be done before we have our focus squarely on community safety. I think the answers to these questions really raise a lot of inconsistencies and uncomfortable truths that are, and you're seeing the effects of that. You're seeing people call for significant reforms, even abolishing systems that we had taken for granted before. And now we're stepping back and looking at it in a new critical light and saying, well, maybe they're not fit for purpose. Maybe we need to make changes. So that's a terrific opportunity.
Great. Well, and let's turn to the other criminologist for the final word. Amy, are there any hopeful messages you can leave us with?
Well, I'm going to echo what Elsa Marie just said, and also point that this is an opportunity when we see a health crisis coming into institutions to really look at what is the purpose of incarceration in Canada, right? Many people believe that we put people in jail to rehabilitate them so that they are, come out better people. Well, the reality is rehabilitation does not occur, particularly in the provincial system, and most definitely not in remand, right? And so here's an opportunity to consider, well, what is the use of remand, and why is it that we see a high proportion of people who are economically disadvantaged and racialized in these spaces? We are incarcerating people who cannot afford to pay their bail. Let's just let that sink in just a little bit, right? And recognize that here's an opportunity for us to look at, well, why are we doing this? And maybe we don't need to. And the fact that we've seen some early movement towards decarceration is really encouraging. But it's only, you're only scratching at the tip of the iceberg. The whole system in and of itself is supported by that process. So, I would like us to think about opportunities to consider, the role that our correctional institutions play in continuing to criminalize people who are living in poverty and punishing poverty as almost a criminal offense in and of itself, right? The bigger issue here is, why do people go to jail? Well, it's not always because, the police are picking them up or they're actually doing more crime. There are social problems that lead to people to having situations that unfortunately get them into crime. So I certainly hope that the decarceration process continues. I hope that we get opportunities to reevaluate how we have healthcare provisions in these institutions. We certainly are seeing this in our seniors' homes. And I would like that to be extended to our correctional institutions, because whether we want to like it or not, and I quite like it, all of these people pretty much are going to be released. These are community members. They are going to come back to us. And so do we allow them to come back sicker and less ready to deal with the stressors of society, or do we do something else about that? And this is an opportunity for us to really put the boots on the ground to make that happen.
Well, thank you. And the phrase "punishing poverty" is going to stay with me. That's I hadn't thought of it that way. Well, and thank you both, Elsa Marie and Amy, for your time and insights today. And thank you also those at home for joining us. I hope to see you all again in 2 weeks' time when we welcome Professor Emeritus Dr. Harry Kitchen. And let me add that Harry was my economics professor way back when I was at Trent in the mid-1960s, so a particular delight to have him on the show, along with Dr. Saud Chaudhry. And they'll be discussing economic recovery in Canada. In the meantime, let's keep the conversation going by submitting questions for our next episode and continuing the discussion on social using the hashtag Trent Talks. Until next time, be safe, and please always remember you are not alone. Goodbye for now.